Okay. Hi, my name is Lindsay Hoops. I am going to do a head-to-toe examination for MSN 610. Here we go. Here's my workstation. Blank piece of paper for the mini cog, and then we'll do a 360 environment scan. Okay, so the first thing I'm going to do is I'm going to wash my hands. Hi, my name is Lindsay Hoops. What can I do for you today?
For a checkup.
Okay, so since you're a new patient in our practice, I'm going to complete a head-to-toe comprehensive exam. Is that okay?
Yes.
All right, so the first thing that I'm going to do is I'm going to start with a set of vitals. While I take your blood pressure, I'm going to have this under your tongue, temperature. All right, so finding the artery. (116/70). (97.7). All right, and now I'm going to check your pulse and your respirations. All right, 64 and respirations are 16. Oxygenation is 99%. Taking a look at your general appearance, you have a good posture, you appear your stated age, and you don't appear to be any distress or having difficulty breathing. So taking a look at your skin, normal color for ethnicity, it's warm and dry, no obvious rashes or wounds. Taking a look at your face, it's symmetric. And then taking a look at your skin turgor. Okay. All right. Hydration status seems normal. There was no pitching or tinting noted. So I'm going to have you, I'm going to test cranial nerve number 5, which is sensation. So this is sharp and this is dull. And I'm going to have you close your eyes and tell me which one you feel.
Sharp. Dull. Sharp.
Okay, that was cranial nerve number 5, which was intact, and you had normal differentiation. So the next cranial nerve I'm going to test is cranial nerve number 7. I'm going to take off your glasses, and I'm going to have you smile really big for me. Puff out your cheeks, and frown. Okay, and then close your eyes and close them tight, and don't let me open them. Okay, that was cranial nerve number 7. That was intact. And now I'm going to have you put your glasses back on. And I'm going to take a look at your scalp here. Any pain when I palpate?
No.
All right, so I don't see any alopecia, any skin changes, lesions, rashes, or wounds. I do see 2 scars here. What was that from?
Cyst removal.
A cyst removal? Okay, how old were you when that was
18.
done? 18? Okay. All right, and no pain there, correct?
Nope.
Okay. Perfect. And I see that you have corrective glasses. We're going to move on to your eyes. And this is the Rosenbaum. Measure that there. Now, cover up your right eye and read this line from left to right.
CFDHJ.
Okay, and then I'm going to cover the other eye. There you go. And then now right to left.
JHDFC.
Okay, perfect. You have 20/25 out of both eyes bilaterally with corrective lenses, and I'm just going to take a look at your eye here. The sclera is shiny and white. Can you take off your glasses for a second? Okay, now look up. Conjunctiva is pink and moist. No signs of any drainage or conjunctivitis. I'm going to take a look using my pen light at your pupils. And that Rosenbaum test tested cranial nerve number 2. Okay. Pupils are equal, round, and reactive to light. Or 2 millimeters bilaterally. Now you can put your glasses back on. I'm sorry. Okay, and this is going to be the H test. It's testing cranial nerves 3, 4, and 6. Okay, and don't move your head and just follow it with your eyes. Very good. No nystagmus was assessed. So I'm going to take a little bit deeper of a look with my ophthalmoscope. Okay, can you remove your glasses? Now this can be kind of bright, so I'm going to have you kind of put stare straight ahead at a point, and I'll be as quick as possible. Okay, red reflex is there. Optic disc is sharp. Red reflex is there. Optic disc is sharp. Very good. You can go ahead and put your glasses back on. All right. So now moving on to your ears. Any pain when I palpate?
No.
All right. No signs of any spots, lesions, rashes, or wounds. And then no palpation or no tenderness assessed. I'm going to go ahead and take a look inside your eye or your ear with my otoscope. All right, tympanic membrane is translucent, pearly white, no bulging, signs of drainage or edema, and mild or minimal amount of cerumen assessed. Tympanic membrane is translucent, pearly white, no bulging, no excess fluid or drainage, and mild or a little bit of cerumen there too. All right, so now I'm going to do the whisper test. I'm going to stand behind you as you plug one ear, and then I want you to tell me what I say. Okay, whisper.
8-9D.
Okay, and other.
6FA.
Perfect. Gross hearing is intact. That's cranial nerve number 8. And then we're going to do, take my tuning fork, and these are 2 hearing tests. It's called the Weber and the Rhine. So the Weber test, I hit my tuning fork, put it in the middle of your forehead, and I want you to tell me if it's louder in one ear or the other, or if it's equal.
Equal.
Okay. Very good. Now the Rhine test is I'm going to put it in 2 locations, one behind your ear and one in front, and I want you to tell me which one is louder.
Second.
Okay.
Second.
Okay, perfect. All right, that's intact. All right, so now moving on to your nose. Any pain when I palpate?
No.
No? Okay, can you go ahead and remove your glasses? It makes it a little bit easy for me to, I'm going to palpate your sinuses. Any pain?
No.
Any pain?
No.
All right, sinuses, I don't feel any edema or swelling, no pain upon palpation. Okay, so I'm going to go ahead and take a look up the nose with my otoscope. There we go. All right, go ahead and lift up. Okay, and another side. Perfect. Nasal septum is intact in midline, no deviation noted. All right, now I'm going to go ahead and test your the nasal patency. Go ahead and plug one side of your nose and close your eyes. Tell me what you smell.
Coffee.
All right, keep your eyes closed. Plug the other nose. What do you smell?
Coffee.
Okay, perfect. Cranial nerve number 1 is intact. And then I'm going to go ahead and take a look at your mouth using my otoscope. All right, go ahead and open your mouth. All right. Hard palate is pink, intact, no signs of rashes or lesions. Pharynx is free of lesions, as well as the tonsils, no spots noted. Go ahead and stick your tongue out for me. Okay, and then go off. All right, that is cranial nerve number 10. Uvula is midline. Uvula is midline with no lateral movement. And then go ahead and touch your tongue to the roof of your mouth. Soft palate is pink, intact. No signs of lesions, wounds, or rashes. Dentition is intact. No sign of dental caries. Very good. Okay, and now testing cranial nerve number 12. I want you to stick your tongue out for me. Wiggle it side to side. Okay. Now press your tongue against against your cheek, against my hand. Okay. Okay. Perfect. And then now I'm going to that's cranial nerve number 11, or 12 rather. And then 11, I'm going to have you shrug your shoulders. Okay. And then push your head against my hand. Push your head against my hand. Okay. Perfect. Okay. And now moving on, we're going to feel for your cervical lymph nodes. So this is the cervical chain. Okay, pre and then post auricular, submandibular. Okay, and then kind of shrug your shoulders up a little bit, or like forward too, so I can get under there. There you go. Okay. Lymph nodes are non-palpable in the cervical chain. It's non-palpable as well. Okay, and so I'm going to have you hold this water, and I'm going to feel for your thyroid. All right, go ahead and take a sip and swallow for me. All right, thyroid is medial, no enlargement noted. Cranial nerve number 9 is intact. Okay, and so now I'm going to take a listen to your carotid arteries. Okay, and then I'm going to switch it to my bell, make sure I'm not missing any murmurs. Okay, and the other side. Okay, and then I'm going to palpate. No murmurs were noted. Making care to only do one side at a time to not restrict any blood flow. Very good. So +2, and it's symmetric, so bilaterally equal. Okay, and then so now I'm going to have you go ahead and lay down, and we're going to assess look for your PMI, your point of maximal impulse. Point of maximal impulse is palpated at the 5th intercostal space midclavicular line, which is normal place. So I'm not concerned about any ventricular hypertrophy that's pushing that away. The angle of Lewy. Okay, I do not palpate any thrills or lifts or heaves. Now I'm going to take a listen to your heart. All right, so the first area I'm going to be listening to is right up the sternal border and the 2nd intercostal space, which is the aortic. And then right across from that in the 2nd intercostal space, left of the sternal border, is the pulmonic. And then 3rd intercostal space is the 2nd pulmonic. Okay, and then 4th is the tricuspid. And then 5th intercostal space midclavicular line is the mitral area. Okay, and then now I'm going to listen to those same spots with the bell to make sure I'm not missing any lower pitched murmurs. Very good. No murmurs were assessed. I heard S1, S2 throughout with no extra heart sounds, clicks, or murmurs. Okay, so I'm going to have you go ahead and sit up for me. And I'm going to assess your lung sounds. All right, and then taking a look at his chest, he has easy, unlabored breathing. No retractions are noted. No lesions or wounds or anything like that. Nice deep breath in and out for me. All right, and then I'm gonna have you kind of turn to the side so I can get to your back. Good. Okay. I heard bronchial breath sounds over the trachea, bronchovesicular in the thoracic, and then at the bases I heard vesicular breath sounds. Throughout, it was clear bilaterally. And now I'm going to have you kind of stand up, and I'm going to test your chest expansion. Go ahead and turn around. Okay. All right. Take a nice deep breath in and out. All right. So symmetrical chest expansion. And now I'm going to test for tactile firmitus. Go and say 99.
99.
99.
99.
And then 99.
99.
Okay, so no increased tactile firmitus, which would alert me to any consolidation. And then I'm also going to listen at these. I'm going to have you say E and drag it out, and I'm going to assess and see if that, if I can hear that. Okay, now say E.
E.
Okay, and then one more time.
E.
Okay, so negative egophony, which would also alert me to consolidation if I would hear that E turn into an ah sound over his faces. Okay, so I'm going to have you go ahead and take a seat again and lay down, and I'm going to assess. I want to look at your JVD and turn your head that way just a little bit. Okay, so does not rise above the level of the clavicles, which is normal. Turn your head this way. And over here as well, so it's symmetric bilaterally, which is good. Okay, so now we are going to do your abdominal assessment. I do not see any distension, ascites, or obvious rigidity. Okay, I'm gonna take a listen, and I would normally listen in all 4 quadrants for 2 to 5 minutes, but for video purposes, we're gonna cut it down. Okay, bowel tones are normoactive and no hyperresonance or not hyperresonance, but hyperactive bowel tones are noted. Okay, and I'm going to do percussion. I'm going to step up here to assess for liver border. Okay, dullness is noted to the right intercostal space, midclavicular line, which would alert me to the upper sternal border, or upper liver border. Okay, dullness stops right about this level, which would alert me to the lower liver border. Okay, dullness is noted to percussion over the spleen, and then normal percussion over the rest of the abdominal cavities. Okay, so, and now I'm going to, before I do this, listen for any murmurs or bruits over your arteries in your stomach, using the bell of my stethoscope. This is the aorta. Okay, and then the renal. Iliac, and then femoral. Okay, no bruise or murmurs noted. And now I'm going to do light and deep palpation. So let me know if you feel any pain, okay?
Okay.
No rigidity is noted, and no tenderness with light palpation. This over your spleen. Okay, liver. All right, so now I'm going to do some deep palpation. So if it ever becomes uncomfortable, just let me know, okay?
Okay.
All right. Your spleen. I'm feeling for any masses. No masses are felt. All right, now I'm going to have you take a nice deep breath in. Liver edge is actually able to be palpated, and it's smooth and firm. No abnormal masses or uneven surfaces are palpated. And I'm going to do the ballottement technique for the kidney. And that is not non-palpable. And it's non-palpable. And while you're laying down, I'm going to go ahead and take a look at your upper and lower extremities. So the temperature is nice and warm. No cyanosis. I'm going to take a look at your fingers. No cyanosis is noted. Checking cap refill. And it returns underneath 2 seconds bilaterally. No clubbing is noted. And no edema. Okay, I'm going to check your lower extremities. Okay, no edema is noted. Nice warm temperature. No lesions, rashes, or wounds. No clubbing. And cap refill returns briskly underneath 2 seconds. Okay, and then I'm going to have you go ahead and stand up. All right, so I'm going to feel your spinal processes. Any pain when I press?
Nope.
Okay, now your paraspinal. Any pain when I press?
Nope.
All right, perfect. So I'm going to check your cervical range of motion. This is C7T1. Turn around here. I want you to do a flexion. Put your head down. Now back up, all the way back up, and to touch your ear to your shoulder. Both sides. Okay, perfect. And so that was a good full range of motion of your cervical. I'm going to check your spinal range of motion. Go ahead and touch your toes. Okay, good flexion. Now extend back. Okay, very good. Now lateral side bend. Very good. Okay. And while I have you standing over here, I'm going to check your shoulder range of motion. So I'm going to have you extend your arms way above your head. Okay, and that's abduction. Now, one at a time with your elbow straight. I want you to adduct over. Like that. Now do it yourself the other time. Okay. All right, and I'm going to try and do that for passive range of motion. That was good active. Okay, very good. All right, I'm going to have you go ahead and check your elbows. Okay, like that, and then flex, and then extend. Okay, now I'm going to do pronation and supination. So I'm going to have you go ahead and pronate and then supinate. Okay, very good. Okay, and then I'm going to check your fingers. Now open them up like that, and then close them, and then go down, and then go up. Okay. And I'm going to do passive range of motion. That was good active, full range of motion. Okay, so I'm going to have you go ahead and go like this again. I'm going to test your strength. Don't let me pull. Don't let me pull. Now push, push. Okay, now push out. Okay, push in. Very good. Okay, now I'm going to have you go ahead and sit down. And I'm going to actually have you go ahead and lay down. Checking the range of motion of your lower extremities. I'm going to have you, one at a time, drag your heel up towards your butt. Okay, back down. Another one. Okay, and then I'm going to have you lift your legs, keeping your knees straight as far as you can. Okay, very good. All right, and I'm going to do passive. Okay, very good. Now I'm going to actually have you sit up, and I'm going to take a look at your feet and ankles. So go ahead and flex your feet down. Okay, now dorsiflex them up. Very good. All right, press down. Okay, push up. Okay, now kind of out. There you go, and in. Okay, so muscular strength is 5 out of 5 in the upper and lower extremities bilaterally. He's demonstrated full range of motion of his active and passive range of motion. I'm going to have you go ahead and lay back down again. So taking my tuning fork, I'm going to assess your vibratory sense. So tell me when you feel it stop, the vibrations.
No.
Okay, that was the same time as I did.
No.
Okay, perfect. And I'm going to test your sensation. So I'm going to have you close your eyes and tell me if you feel sharp or dull, okay?
Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Okay, very good. All right. So now we get to do a fun part, and I'm going to test your reflexes. So I'm gonna have you sit up. All right. So I'm gonna check your brachial reflex. Find that tendon. So I'm gonna have you flex your arm. That way it's easier for me to. There it is. Okay. Now. Okay, good contraction. Try to test it again. Very good contraction of that. There we go. Good contraction of the bicep there. Going to test the brachioradialis. Find that tendon. Go up and then support here. Okay, good contraction there. Good contraction there. And we're going to do your tricep tendon. Go about 2 inches above where the elbow, the olecranon process. Good tricep there. Good tricep contraction there. And then we're going to go down to your patellar. Here. Okay, contraction there. I'm going to kind of support because you're too tall for this couch. Okay, very good contraction there. And then your Achilles. So I dorsiflex your foot up like this. Go right above where the insertion site is. Okay, and then I flex, do a plantar flexion downward. Okay, very good. All right, so his deep tendon reflexes are all intact, +2. Which is normal, and they're symmetrical, which is the most important thing. I'm going to have you stand up. Close your eyes, and with your hands down by your side. This is the Romberg test, and so you have a negative Romberg, and then I'm going to have you do heel to toe and walk in a straight line. Okay, and back. All right, and turn around. Close your eyes and put your arms up. No pronator drift. That's good. Okay, and you can go ahead and sit back down. I'm going to do a couple of coordination assessments. So I'm going to have you touch your nose. Okay, and then touch my finger. You really get that? Okay. Touch your nose. Touch my finger. Touch your nose. Touch my finger. Okay, very good. And now I'm going to have you come over here, and I'm going to do a mini cognitive test. All right, so I'm gonna tell you 3 words: sand, ball, dog. Sand, ball, dog. And I want you to repeat those at the very end of the exam. I'll ask you about it, okay? But right now, I want you to draw me a clock with the full numbers on it and show it telling 3 o'clock. Okay. And what is your name?
Michael
Where are you right now?
Deschler.
Who's the president?
Donald Trump.
Okay. What month is it?
November.
Okay. And can you count backwards from 100 down to 0 in serial 7? So count backwards by 7.
193. 85. And after that.
Okay. And what is your age?
34,
What year were you born?
86,
Okay. And what were the 3 words?
sandball clock.
Sandball clock. Okay. Okay. And so very good. Here. All right. So that was your exam. You did very well. I would recommend that you come back in a year and for an annual wellness check. Do you have any questions?
Nope.
No? Okay, perfect. Well, thank you very much. I'm going to wash my hands. And we'll see you again.